Hello, my name is Lynn Robbins, and I'll be submitting my videos tonight. Today's date is 8/22/2016, around about 9:45 p.m. I will be doing my video submitting clean catch, stool sample, as well as sputum. Starting with the clean catch, in order for me to get a clean catch, I would enter into the patient's room. I would identify myself, and I would make sure it's the patient that I actually want by asking them their name and date of birth and checking with their armband. And also, I would explain to them the procedure that we would need, and I would wash my hands and glove up. And if the patient is able to do it themselves, I would explain to them what they would need to do. They would go into the bathroom. They need to wash their hands as well. And it would be 2 towelettes to clean themselves from front to back. And then you would proceed to urinate. You would urinate some and then stop. Then you would put the cup under so you can catch some in the cup. Then you would stop again and move the cup out of the way, and you would complete or finish urinating in the toilet and clean yourself as usual. I would get the urine sample, I put a top on it, and I would make sure I would label it with the patient's name, date, and time collected. For the stool sample, I would get a hat, collect the things that I need from the outside first. I would enter the patient room. I would explain to them the procedure, and I would make sure I wash my hands and glove up. Explaining to them the procedure, I would explain to them what a hat is, and the hat will go into the toilet. And when the patient go in to use the toilet, also, I would make sure that it's the right patient by identifying them with the band and asking them their name and date. And when they go in to use the toilet to get a stool sample, when they use it in the hat, I would tell them, try not to urinate in with the stool, as well as put tissue paper in with the stool, because it'll contaminate the specimen that we would need. And once they're done, they would clean themselves as usual and wash their hands. I would help them get back into bed if they need help and get comfortable. I would get the stool sample, and with a spatula or a wooden stick, I would get some and I would put it inside the cup, and I would make sure I would label the patient's name, the date, and the time that I collected the specimen. Now with the sputum, I would go into the patient, make sure it's the patient that I want by identifying them. I would introduce myself and explain the procedure. And I would explain to them that I would need for them to breathe deeply 3 times and cough up deep cough up way down. You need to take in 3 deep breaths in, and then cough up the sputum, and then spit it in the cup. And then with that, I would close it off, and then I would make sure that I would label it, the time and date, the date and time collected. And that is my three collections, and this is my video. Thank you so very much. Bye-bye.